We are pleased to be joined as part of our series looking at veterans issues by Vincent Immiti, who is the Director of the Department of Veteran Affairs, New Jersey Healthcare System. Vincent, thank you for joining us. We just had a panel discussion here at the Healthcare Foundation in New Jersey talking about the needs of veterans. Talk about your role in all this.
Well, our new secretary has got us really,
Secretary
of Veterans Affairs, has got us very excited about reaching out to veterans and providing those services to veterans they need when they need them. So if we are going to provide veteran services, they don't necessarily have to be at the medical center or at one of our 10 outpatient clinics. They may be at a community medical center. Whatever the veteran needs, we are emphatic about getting that service provided for the veterans.
Is it hard to access and have veterans access what you and your colleagues provide?
Well, we serve currently 47,000 veterans a year, 47,000 unique
In
patients.
New Jersey?
In New Jersey, yes, sir.
47,000?
47,000.
What kinds of services are we talking about?
We are a tertiary care medical center. We provide medicine, surgery. We have a very large psychiatric and mental health practice. We have long-term care. We have residential care, all kinds of rehab therapy.
Let's talk about the mental health issues. What are we talking about?
PTSD.
How does it manifest itself?
It manifests itself with patients flashing back, generally, not being able to hold a job, oftentimes because there's a trigger that sets them off, and they have a very difficult time coming back into the community after their service. We are experts in PTSD and have been for many years. During 9/11, for example, we were called upon, the VA in general was called upon to help with post-traumatic stress syndrome with all the patients who were experiencing those kinds of symptoms in private industry. So we are expert in it. I am not a clinician as far as mental health services are concerned, but we do have a very large cadre of both male and female services. Believe it or not, we actually have a PTSD unit specifically for female patients with PTSD.
Why?
Female patients have to be, I don't want to say segregated because that's the wrong term. They have to be treated differently than males because they have different issues. And oftentimes, the male influence is what started their PTSD in the first place.
Really?
So having them separated helps them to heal and helps them to become more, I don't want to say healed, but
Is that they get that unique, specialized help they need?
yes, specific to females.
Let me ask you this about the VA. Let's deal with the perception issue on the part of some. That the VA has not done the job that it is needed to do to help our veterans, and that some watching right now, veterans, family members, and others, citizens who care, aren't convinced that the VA is the place to go, you say?
I would say so, but we are committed to taking that perception and turning it around.
How so?
Our secretary, again, we had a meeting in Washington a couple of months ago, and he talked about the CEO of Amazon. And the CEO of Amazon said he was customer obsessed. Well, I would argue that we need to be veteran obsessed. And that's what our secretary is asking us to do, is to go and get the veteran whatever they need, within the confines of the law, obviously, but what they need, when they need it, where they need it.
Is that different than the previous culture of the VA?
Well, generally, years ago, before we had community-based outpatient clinics, everything was at the medical center.
Like, you got to come to us. We're here. You want to find us? Find us.
Exactly.
If not, it's your problem.
Now we're reaching out to communities, we're reaching out to veterans groups, and we want to bring the veterans in. We want to treat those veterans who need our services.
Why do you do what you do?
My dad was a veteran. My dad actually passed away in a VA medical center a few days after Hurricane Sandy, as luck would have it. And I watched the care that he got. And I was proud of the care he got. In the VA. I watched the care he got. And the story really is that I had just left his bedside. My mom was still at his bedside, and we got a call as soon as I got home that he was breathing his last. When I went back, there were 2 nurses' aides in the room sitting with my mother, and they were just comforting her. When I got there, they both stood up, and they gave me a hug, said they were sorry, and they left us there. That level of caring always struck a chord with me, and I said, this is what I aspire to and continue to aspire to do with my career. I want us to be that caring institution that takes care of those people who defended our freedom. And I believe in that mission, and I believe in that mission every single day.
Well said. Thank you very much.
Thank you.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by New Jersey Sharing Network, the Healthcare Foundation of New Jersey, JAG Physical Therapy, Georgian Court University, Valley National Bank, Verizon, and by Fedway Associates.